Hello, and thank you for joining the Wisconsin Cheesemakers Association for this special webinar, Boosting Vaccine Confidence and Participation Rates in Your Workforce. My name is Rebecca Sweeney, and I serve as Communications, Education, and Policy Director for the Wisconsin Cheesemakers Association. And I'm so grateful that you were willing to take some time out and talk with us today about this important topic. Here's a look at our webinar agenda. First, we're going to make some introductions, and then we are going to get into an update on how vaccine administration is going across the country and here in Wisconsin. Then we're going to be talking a lot about vaccine confidence and how you can boost that and participation rates among your workforce, your valued employees. And finally, we'll close out with a question and answer session and a look at some industry resources. First, let's begin. Let's talk a little bit about vaccine administration. Here's a look at how we're doing nationwide. The darker blue colors indicate higher vaccination rates across the country. You see in the Northeast, those very dark blue, those Navy states. And that's really where we're seeing folks starting to reach that 70% threshold that President Biden set as his goal some months ago. In Wisconsin, you see kind of a middle blue color, and we'll get to that in a second, but here are the numbers. 165 million Americans have received at least one dose of a COVID-19 vaccine, and that's approximately 50% of the total population, which is terrific considering that there are a lot of children out there who are not yet eligible to receive a vaccine, and we know there is some vaccine hesitancy, which is why we're talking today. What we've seen is fully vaccinated Americans, 131 some million Americans are there. And that amounts to almost 40% of the population. You can take a look at this vaccine tracker information at covid.cdc.gov. They update that information daily. Here's a look at how things are going in Wisconsin. Again, the darker the color you see on that map, the more people are vaccinated in those counties. Right now, Dane County leads the way in Wisconsin, and they're experiencing some of the highest vaccination rates actually in the nation. 2.76 million Wisconsinites have received at least one dose, and that again, we're approaching half the population, 47 some percent. Fully vaccinated, we're at 2.4 million. Now it's my distinct pleasure to introduce our special guest speaker today, and that is Elise Balzer. And she is with the CDC. She is the public health advisor to the Wisconsin Department of Health Services, and she's been an incredible resource throughout the past 15 months. And again, she's filling that role for us today, helping us talk a little bit about how we can talk about vaccines with Wisconsin's dairy processing workforce and really the dairy processing workforce nationwide. Elise, thank you for joining us.
Oh, thank you so much, Rebecca, for that very warm welcome. I appreciate it. And I just want to take a moment to thank everyone on the call for the work that you do around, our economy in Wisconsin and some of the awesome events that are put on through the industry that you work in. So thank you so much for joining us today, and hopefully you're able to glean some takeaways from this presentation. So as Rebecca said, I am with the I'm with the Centers for Disease Control and Prevention, and I am assigned to the COVID-19 vaccine rollout here in Wisconsin. I'm sorry, my slides aren't moving ahead. Oh, there they go. So to start off, I just thought we should maybe talk about some shared language. So talking about what we mean when we talk about what vaccine confidence is. So this slide's from the CDC. And in a poll that was done in last October, it was found that about 58% of the general public said that they would feel comfortable receiving a COVID-19 vaccine. Now, these polls, have varied. Some have said anywhere between 60 to upwards of 90% of folks would be willing to get a COVID-19 vaccine. But just to give you a sense of kind of where we're at with everything. And what we found from this poll is that folks, the factors weighing on whether someone would get a vaccine is they want to know, are there side effects? They want to know, does it work? And is it safe? How much does it cost? And they also said that they would be interested in getting a vaccine if their healthcare provider or or someone trusted shared that if it was safe, if there was no cost to the individual, and if it would help them get back to school and work, and if it was easy to access. And so thinking through kind of those main questions, vaccine confidence then is the trust that patients, parents, or vaccinators or providers have in those recommended vaccines. Trust in the person who's actually administering the vaccine, so the person who's giving the shot in the arm, and the processes and policies, policies that led to vaccine development, licensure, manufacturing, and recommendations for use, as well as accessing or locating a vaccine. I really appreciate this slide so much. This is also a CDC slide because I feel like it is a nice visualization of what vaccine hesitancy versus vaccine confidence looks like. So on this side of the continuum, we have those who are absolutely will never ever get the vaccine no matter what we do, no matter how easy it is to access. And then on this side of the continuum, we have those who were very eager to get the vaccine and also had access early on in the vaccine rollout. What we know is that the majority of folks are in this middle and fall into this kind of passive acceptance group and have kind of a wait and see approach. If anyone's kind of familiar with marketing terms, you know, it's often referred to as the movable middle. So how do we build vaccine confidence? And as Rebecca and I were kind of talking about how to prepare for today, we thought of kind of these three strategies around building confidence. So we talked about making accessing the vaccine easy, and we'll go into a lot more detail about that. We talked about sharing some key messages and resources with your staff at your agency. And then we talked about communicating individually, and you know, communicating on an individual level could be done either in your professional role, but maybe it's also going to occur in kind of your non-professional role in your day-to-day life. So we'll talk about some strategies for all three of these over the next few slides. Let's start with accessing the COVID-19 vaccine through employers, through you all. So you can request a vaccinator that can come out to your place of employment to provide vaccines. This is a free service. It is coordinated by some of my colleagues at DHS. And so your first step for making this request is filling out this survey. And I would say, I know Rebecca is also going to be sending out a number of links. The survey that I hyperlinked here is going to be included in that email, so you will definitely have access to that. But step one is filling out the survey. If providing a vaccine on site is a challenge, maybe because of space challenges or you know, whatever barriers that might occur, our vaccinators can go ahead and set aside a special time for your employees where they can come into the clinic or pharmacy to get the vaccine. And then step two, in preparation of a vaccine site, is sharing those resources about the vaccine, like the social story or what folks can expect after they get vaccinated and what they can expect once they're fully vaccinated. And then step three is going ahead and letting your employees know where they can get the vaccine. So either through the on-site clinic that through the survey request, or they're also available through vaccines.gov or by calling 211. And so thinking a little bit more about how to create that messaging within your agency. So what we talk about is in vaccine world is creating an environment where getting the vaccine is seen as normal. And so one of the ways that you can do that is by hanging posters in staff lounges and by sharing stories about when people get their vaccines in newsletters, providing stickers, you know, and other examples as well. And then we also ask if you are able to go ahead and provide scientifically accurate information in advance of the clinic or while you're encouraging vaccination. as I mentioned before, there are going to be a number of resources for this that Rebecca will email out. And then we also ask if you have capacity to communicate so that your employees know what to expect if you're hosting a vaccine clinic on site. So where they can go, about what time, and who will be vaccinating them. So for example, if it's a pharmacist or maybe nurses from a local clinic, just so that they know who to expect. And then the next piece that we talked about is communicating on that individual level. And again, you may not have that role within your agency necessarily, but perhaps you might experience this in your day-to-day life. So we wanted to provide some tips or tips around that. And knowing that the reasons why people accept or avoid a behavior change, like getting a vaccine, is complex, and that getting people to accept a new behavior is to approach them with compassion and to connect on a human-to-human level. So tips for connecting and talking with empathy. So listening with empathy and without judgment to explore that individual's concerns. We say often you don't need to go outside of your comfort zone, that you can encourage people to talk to their doctor about their questions. So maybe your message to someone may not be, go get the vaccine. Your message to someone may be, go talk to your doctor if you have questions. It's always helpful to go ahead and ask if you have their permission to share, and if they agree, they'll be more willing to listen. And it will feel less like you are kind of pushing unwanted information or trying to indoctrinate someone. Encouraging people or helping people find their why for getting vaccinated. So if I can just share a personal story for a moment, my sister-in-law was very nervous to get vaccinated. And so my husband was able to help her think through, well, I know that you have these fears. What would be your motivation for overcoming these fears? Why would you want to get vaccinated? And so for her, it was being able to see her family again safely. And then for those of you who can, help make the right thing to do the easy thing. So again, offering to help with childcare if you're available, helping folks find a vaccinator, or going ahead to find them transportation to a vaccination site. So now I'm going to switch gears a bit and just talk about COVID-19 virus for a minute, because over the next few slides, we're going to talk about how the vaccine works. But before I do that, I just want to lay some groundwork. And if you know this already, wonderful, just stay with me for just a second. So we know that COVID-19 is caused by a virus. It's a coronavirus, and it has its telltale kind of feature are these spike proteins that make it look like it has a crown. And we know that the virus can make you feel sick, and some symptoms can range from a mild cold to more serious illness that can result in hospitalization and death. And while we don't know the range of symptoms, while we know the range of symptoms, we don't know how the virus will affect each person. And we do know that some people are more likely than others to become very sick. So for instance, those on certain cancer treatments or with heart disease or individuals with diabetes. So next, let's talk a little bit about how COVID-19 vaccines work. So starting with kind of an overview, the way the vaccines work is it helps protect you from COVID-19 virus. And it does this because it helps your body recognize and prepare to fight against the virus in advance. So then let's go ahead and talk about some of the different vaccine technologies that are available. So we have the first vaccine technology that I'll talk about is called mRNA vaccines. So these are the Pfizer and Moderna products. And the way that the mRNA work is that the mRNA carry genetic material that teaches our cells in our bodies how to make a harmless piece of spike protein, which we talked about earlier. which is found on the surface of the COVID-19 virus. This helps our bodies recognize what COVID-19 looks like. And then the cells display this piece of spike protein on their surface, and this process makes our bodies ready to identify and react to the virus. So in other words, it prepares our immune response. And through this process, our bodies are able to make antibodies to protect us from getting sick if we come in contact with the COVID-19 virus. The other technology that is authorized in the United States is called a viral vector, so a viral vector vaccine. Viral vector vaccines use a harmless part of the virus, again, a piece of that spike protein, or excuse me, use a harmless virus that's too weak to make you sick, to teach the cells in our bodies how to make the coronavirus spike protein, which is also harmless on its own. And through this process, our bodies know what COVID-19 looks like and gets ready to identify and react to the virus. So in other words, it prepares our immune response. And through this process, our bodies produce antibodies to protect us from getting sick if we come in contact with the COVID-19 virus. So in summary, these two different types of technologies, the viral vector, which again is the Johnson & Johnson product, and the mRNA, which is the Pfizer and Moderna, use different technology to essentially do the same thing, which is to teach our bodies how to produce antibodies to protect us if we get sick. To protect us from getting sick if we come in contact with the COVID-19 virus. And so with that kind of background information, now I'd like to go into some of our COVID-19 vaccine frequently asked questions. And the questions that are asked that we go over in this presentation were given to me by Rebecca. And it's my understanding that they came through a survey that you all participated in. So hopefully we're able to cover some of your questions. So the first question, are COVID-19 vaccines safe? I think this is such a great question. Anytime we take any sort of medication, we want to make sure that what we are putting into our bodies are safe. So the way that we know that the vaccines are safe is kind of through three different processes that the vaccines go through. So the first kind of step is that they each went through the required testing for effectiveness and safety. And then the second test is that the Food and Drug Administration, the FDA, reviewed the data from the effectiveness and safety testing and authorized each vaccine after it was tested. And then even with all the testing and after FDA authorization, there's still ongoing monitoring for any problems or unusual side effects. So testing, which is you may have heard in the news, is known as clinical trials. This process for getting approval was transparent and rigorous throughout, with continual oversight from medical experts and final approval by the FDA. So the vaccines went through all three phases of testing that is required for all vaccines, including COVID-19. And there were no steps that were skipped in this process. And the data that was collected through these various phase trials were shared through with the FDA. I'm so sorry, my slides are skipping ahead for some reason automatically, so I'm not sure what's happening there. So I apologize.
Can I ask another question too on this point, Elise? I think that oftentimes we hear this conversation about the difference between emergency use authorization and full approval. So in your mind, your professional opinion, and also knowing, what the projections are for the next couple of weeks, do you feel like a vaccine that has this emergency approval is as safe as having something that's fully approved? And how can folks respond to that kind of a question that they might field?
Thank you so much for jumping in with that, because it's a really important point. So in order to get authorization, the vaccines had to go through all the same testing that regular vaccines go through, that all vaccines go through. The reason that this was able to be, that we were able to kind of speed up the authorization process was because there was just a lot of information sharing both here in the United States and around the world. And so because there was just so many scientists sharing information, as well as all of the funding that was able to go into the development of the vaccines, it was just able to be sped up. So for other vaccines, they often have to, they being vaccine manufacturers, have to search for vaccine funding in order to support the various phase trials. And then the other piece is that these vaccines have been monitored, have been tested for over a year now. So we have safety and efficacy data from back in, the Pfizer trials started in March and April, and the Moderna trials started in April and May. So we have over a year's worth of data on safety and efficacy. And so I think that these are all elements that go into our confidence that these vaccines are safe. And even after they're authorized, as I mentioned, they go through continuous monitoring, which I'll mention in just a minute. Rebecca, is there anything else that would be helpful to be clarified?
No, I think on that point, that's something that I know that we are hearing from folks too, that some folks say, well, I'd really rather see it fully authorized before I get it. And so I think that that just underlining that point of safety, not only the significant trials, but now also the broad application of the vaccine and the real world trial of how this is how this has been implemented and how people have reacted to it is a helpful point to share with people when they have that concern. So thank you for walking us through these different phases and all that had to be considered before they were authorized for this emergency use. So thank you, Elise.
Oh, absolutely. And the next slide is actually then about the monitoring. So after they're authorized. So anytime a vaccine is either authorized or approved by the FDA and being used in the general population, both CDC and FDA track the safety of the vaccines when they're in use. So the first link that I included, so it's the Vaccine Adverse Event Reporting System, VAERS. I have this one in bold because I really want folks to know that that if you or someone you know had an event after vaccination, that you can report to this system. And it is a very well-established system. It's decades old, and healthcare providers are very well aware of its existence and how and the need for reporting any adverse events. And there are very large teams at both the CDC and the FDA that track every single report that goes into VAERS. And in fact, it's really a partnership between healthcare providers, the federal government, and state departments of health services. The vaccine coordinator at DHS receives every single report that she receives from Wisconsin, and she also reviews each of the reports. So there's just tons of people looking at these reports that go into VAERS. The other three safety data links are also very well established, several years old. The vaccine safety data link is a partnership between certain healthcare systems and the CDC to collect data about vaccine safety. And then these other two, clinical immunization safety assessment, as well as the biologic effectiveness and safety system, are also partnerships between healthcare providers, healthcare systems, local and tribal health departments, and the federal government. New for COVID-19 is vSafe, which is an application that helps people track the number of doses that they have and monitor for any post-vaccination symptoms after they get their COVID-19 vaccines. So everyone who gets a vaccine is eligible to sign up for vSafe. And speaking of side effects, there are some side effects that we can all expect. And those include feeling tired, fever, chills, body aches, and soreness at the injection site. Most of these side effects do go away in a few days, and the chance of having a severe side effect is less than 5 in a million. They're quite rare. And we also just want folks to know that if your symptoms don't improve in a few days, or if they get worse, to go ahead and call your doctor. We also want folks to know that the vaccine will not cause respiratory symptoms. So for example, a sore throat or a cough. And that's because the vaccine doesn't contain the virus. So it's not a live vaccine. It's not going to cause infectious symptoms. And in general, while COVID-19 vaccines are safe and effective, we just want you to know that we just want you to be aware that you may not feel well after vaccination and might find this disruptive to your activities for a day or two. And then also, I just want folks to know that some people may not have post-vaccination symptoms, and that is also normal, but the vaccines are still working in your body to build an immune response. The next question that we got from the survey that you all completed was, are COVID-19 vaccines necessary? And I thought this was such an interesting question. And so I kind of broke the response down into 2 parts. So those who've had COVID-19 illness, and then to answer the question for those who not been sick with the COVID-19 virus yet. So is getting a COVID-19 vaccine necessary? So yes, even if you've already been sick with COVID-19, you're still recommended to get the vaccine. So let's go ahead and walk through these 2 different scenarios. So we have immunity-acquired infection immunity, which is just a really fancy way of saying you caught the virus and you got sick. And by getting sick, you were built up some sort of immune response. I'm so sorry, I don't know why my slides keep moving ahead. I apologize. I hope it's not too distracting for everyone, but
no, and I know, Elise, on this question, it definitely stemmed from folks who had employees who had gotten COVID-19 over the past year. And it was definitely that question of, well, do I already have immunity if I've had this and I've gotten better from it? And so that is this, you're right on this point of why we want to know whether it's necessary for all.
That's really helpful. Thank you so much. Yeah, so what we know, or I guess what we don't know about if somebody's been sick with the virus already, is kind of their level of immunity, because it can, from community acquired infection, so from getting sick, the immune response can vary from person to person, and it's based on a number of factors, and particularly an individual's body's immune response to the virus. So it could be because of someone's age, it could be because of someone's underlying health condition. There's just so many things that go into this immunity. We also don't know if somebody with community acquired immunity has protection against the vaccine variants. So maybe in the news you may have heard about variants of concern. And as I said, we just don't know right now if people who have gotten sick and have built immunity that way have protection against the variants, which is why it's still important for someone who's gotten sick to get the COVID-19 vaccine. So now I thought we could talk about kind of immunity from the vaccination. So the protection from the immune response that you get from the vaccine. What we know from the clinical trials as well as real world studies is that person to person, most people have relatively consistent immune response from one person to another. And that response is pretty robust. All 3 of the authorized vaccines in the United States have very good protection against COVID-19. We also know that the current vaccines have good protection against the known COVID-19 variants. And so the other important piece is that you'll have immunity without getting sick, and therefore will not spread the virus to others. So then, as I mentioned, I had kind of two thoughts around this. So then the second thought was around, okay, if someone maybe hasn't had the vaccine, do they still, is it necessary? And so my response is yes, almost everyone 12 years and older is recommended to get the vaccine to stop the spread of COVID-19. So if you'll just bear with me, I have 3 scenarios over the next 3 slides, because I was hoping that we could kind of think through how the virus spreads from person to person. So the sole existence for the COVID-19 virus is to survive. And the way that the virus survives is by spreading, by infecting new people. So on this chart, we have the blue representing people who, I'm so sorry, I don't know why they're advancing. We have people who are not immunized but are still healthy. We have those who are immunized and healthy. And then we have those in red that are not immunized, are sick, and they're contagious. So they are able to spread from person to person. And just to make it a little bit more relevant, I was thinking that maybe you could just in your own mind kind of think about yourself as one of these figures, and think about the maybe 5 people in your circle that you have the most contact with kind of on a day-to-day basis. So in this first scenario, we have kind of no one in our social circles who is immunized. And then we have our contagious individuals that spread the contagious disease, so COVID-19, to the people in their orbit, in their social circles, and the disease spreads through the population. In the next scenario, we have a few people who are vaccinated. These are those yellow folks. And we have a number of the blue folks who are still not immunized but are healthy. And then we just have a few folks who start off contagious. And when they cough or sneeze, and those aerosols are spread to those people in their social circle, then in this scenario over here, we see more people who become sick. And those individuals who are vaccinated still remain healthy. And then in this last scenario, we have a lot of people in our social circles immunized. So again, we have these kind of yellow individuals who are immunized. We have blue individuals who are not immunized, but still healthy. And then our red individuals who are sick. And when those folks sneeze or cough and those aerosols spread, in this scenario over here, we have folks who are not getting sick because they are vaccinated, they have immunity, and the COVID-19 is only spread in limited circumstances. So now, if we can just shift our in your mind, if you can shift a little bit and imagine that these few blue individuals over here are people who maybe can't get the vaccine. So for instance, somebody who for medical reasons can't get vaccinated, or maybe somebody who's too young to get vaccinated, like a grandchild or one of your own children. The people who are surrounding them who are vaccinated have kind of a circle of protection, a cocoon around them, so that the infectious people can't spread the virus to the unvaccinated person. Because again, by vaccinating everybody, the virus runs out of new people to infect. It kind of, the vaccine creates a weak link in the chain of transmission so that the chain can't continue. So thank you for letting me walk through those scenarios. I would also just say, I've heard in the news and I've heard our wonderful public health thought leaders talk about, reaching, 70% of people vaccinated or 80% of people vaccinated. And frankly, for today's purpose, I don't really care about those big lofty goals. For today's purpose and for you, what I think about is really, protecting the people that you spend the most time with and that your employees spend the most time with, so that we don't have to lose any more lives to this virus.
And those are such compelling arguments, right? You're getting vaccinated, not just for yourself, because you might feel confident in your own ability to fight off that virus. You're a relatively healthy human being, right? But who in your circle might have a disease that makes them more vulnerable? Who in your circle is unable to be vaccinated because they're very young? Those people are very important to us, and they're also important to the people that we love. So thinking about those circles, not just your immediate day-to-day life, but just outside that too, all the people that you do interact with one step beyond that. So I think those are often really compelling arguments, and that's what we're hearing from some of our human resources professionals who are having those conversations one-on-one. They're finding that's very effective.
Yeah, thank you so much for that perspective. That's awesome. Sorry, I'm just going to mute a few folks. Okay, there we go. So
now we're talking about access, right? Which is
exactly.
so broadly available, thank goodness. Yes. Now, after clicking
exactly.
refresh on my phone over and over for a week, now you can just walk in anytime, right?
It's true. It's really, really true. So as we mentioned earlier, we have, those mobile vaccination clinics that can come onto your site. And then we have vaccines.gov, which, as Rebecca was just saying, you can just walk in. Many, many clinics and pharmacies have moved to walk-in clinic appointments. Sorry, they're not appointments, just you can walk into a clinic. For those who may not have access to internet, we do have 211, which is a service, free service that can be contacted to help folks find a clinic. And then I also, in the list of resources, provided a list of free or low-cost ride programs in Wisconsin. There are so many groups that are just willing to volunteer or provide free or low-cost rides. It's really, really amazing how many people have just stepped up and raised their hand and just said, yep, I will take people, get them safely to and from their appointments. So the next part is about finding trusted messengers. So the reason I wanted to put this in here is I think in the survey that I mentioned earlier that there was something about not trusting the government's recommendations for vaccines. And I totally get it. I work for the federal government, so I just I feel like I can completely empathize with that sentiment. And maybe somebody doesn't trust me because, I'm talking to you from my house, in Wisconsin, but, I'm just kind of a face on the screen. But what we do know is that people trust their healthcare providers' recommendations. So as I kind of mentioned earlier, part of your messaging can just include, talk with your doctor about the COVID-19 vaccine and the questions that you have. And I would also say that healthcare providers all over the state, again, have stepped up and are willing to have and facilitate small group discussions. And I'd also say that, I have a team of folks who are willing to come and talk as well. If somebody is interested in having kind of a smaller group discussion, we can come and do kind of a Q&A session with your employees if that's something that you're interested in. And so just kind of in conclusion, thinking about how we can help build vaccine confidence. So we talked about, making the accessing the vaccine easy, normalizing getting the vaccine, with your agencies, with your sites, hanging posters, sending out newsletters, sharing accurate resources and information. Again, Rebecca will send out that email with resources. And then if you have the ability and have relationships, with individuals, communicating with empathy.
Thank you, Elise, for that fantastic presentation and for incorporating so many of our member questions into your presentation and providing great answers and information and support as they talk with their employees about COVID-19 vaccination. We want to wrap things up today by talking about some of the additional resources available to industry right now. First, if you have not already, please take a look at the CDC's Essential Employer Toolkit. It has many printable resources, posters for your break room, letters that you could send to your employees, fact sheets that you could make available broadly. For those who do social media, there are even infographics there to help encourage your staff to consider vaccination. The Wisconsin Department of Health Services also has Wisconsin-specific resources. Again, lots of posters here and offered in multiple languages. So we encourage you to take a look at what they have to offer there. And finally, WCMA continues to update its COVID-19 resources on a daily basis. And we want you to know that we are always here to be a resource for you. So if you have questions, concerns, ideas, please bring them to us so that we can better serve you and support your very important work. Thanks so much for joining us today, and we will see you again soon.